you very much. And I'm delighted to inform the House of the recent developments and achievements of the drug policy this morning, and just the government will not be opposing the motion. I actually don't think it's helpful to get into a political dispute about drug policy. It's important not to be arguing over something that affects the lives of so many. And as a new minister, I can assure you I'm very mindful that we are talking about families and people's lives here. And that is my absolute aim, to make sure that I work with the department and with other members like yourselves to work together on this. So the previous government set up the Citizens' Assembly on Drug Use, and the Joint Committee on Drug Use has been re-established in this term. And I will meet with the Joint Committee next week, and I'm looking forward to that. And I have already engaged with the Seanad. I intend to continue to work with all stakeholders to develop the next drug strategy. And that is very important for me, that all of us working together here to achieve this. This is not just a Dublin issue, this is a country issue. It's across all the country, and I see it myself since I became a minister. I would like to reaffirm the government's commitment to a health-led approach to drug use. People experiencing problematic drugs should be met with compassion, dignity and care, and I'm very mindful of that. The health-led approach to drug use is set out in the National Drug Strategy, and the government's priority is to develop a successor strategy to cover the period to 2026 to 2029. The work on the successor strategy will advance, and I have established a time-bound, independently chair steering group to provide oversight, guidance and expert advice in the drafting. I have asked the group to complete this work and present a draft strategy for consideration by December 2025. So that's my aim. We can see how important this is. And for me, this is what I have to do. As you said, Deputy, be brave. I need to be brave now. I need to have the first draft of this strategy by December 2025. And that's what I want as Minister. So the steering group is a technical group brought together to distill the Citizens' Assembly recommendations, independent evaluations and stakeholder consultation into a comprehensive successor national drug strategy. So the strategy will guide the development of delivery of a health-led approach to drugs over the next 4 years. The membership is drawn from the government departments with its associated agencies, people with lived experience, and that's another thing. I am very mindful that we are working with people with lived experience and clinical and research expertise. The steering group is supported by the reference group of the stakeholders who complement the technical expertise, ensuring the new strategy is informed by real-world knowledge and lived experience. That's what I'm going on now. I want to make sure, as you have said, and I totally agree with you, it's all about families and people with lived experience. The membership is drawn from the civil society task forces, community-based service providers and family support services from around the country. A significant proportion have lived and living experience of drugs. Both groups are well advanced in their work and are on track to deliver the draft strategy by, as I said, December 2025. I am committed to publishing the successor drug strategy in early 2026, and I am determined to avoid delays, as emphasised by the chairs of the Citizens' Assembly and the joint committees. The government will allocate over 300 million on drug-related public expenditure in 2023, including 160 million on the drug services. So this represents an increase of 28% on the 2017 funding levels. A further 4.2 million and 34 posts for drug services and initiatives were secured in budget 2025. Additional investment of 11 million was secured in budget 2026 to address gaps in the service provision. And I'm very mindful about services as well. I think you're right. I think it's very important for me around the whole country that anybody that needs to access services, that we have the services there for them. So this funding will enhance access to delivery of drug services in our community. It will also strengthen the prevention of drug use among children and young people and minimise the harms of drug use for families and communities. In developing the new strategy, we must consider the wider problem of drug use across society and provide appropriate services to meet the health and social needs of the diverse population groups who use our drugs. There was a record figure of 13,295 cases treated for problem drug use in 2024. This represents a 50% increase in capacity of treatment places since 2017. and reflects our ongoing investment in expanding services. Demand for drug treatment across all regions of the country, all ages, men, women, people with children, those without, and those who are unemployed, as well as those employed. So we are looking across all the sectors. The supervised injection facilities, which opened in Dublin City in December 2024, I'm delighted to see that during its first 7 months, staff have assisted in over 1,000 clients, and there have been over 120 interventions to prevent a fatal overdose, and as you said, really important. I've seen how the facility is helping to save lives. The facility will be evaluated over the 18 months pilot phase, and this will inform decision about continuation of the Dublin facility and the development of facilities across other regions. So we are looking at that too. So just on the health diversion scheme, the programme for government commits to divert those found in possession of drugs for personal use to health services. This will be done through the health diversion scheme. So this scheme embodies the health-led approach to drugs, and it will lead to better outcomes for people and communities. So along with the Minister for Justice, Home Affairs and Migration, I have agreed that the health diversion scheme will start on an administration basis, with the possession of controlled drug will remain illegal. People with drugs for personal use would be given an opportunity to engage voluntarily with the health care service. As health and well-being, that's something I am, again, as I said, mindful of. An Garda Síochána and the Director of Public Prosecutions are finalising the operational details. Once we have sign-off, the scheme will start at a national level, and this scheme is in line with the recommendations of the Citizens' Assembly. I am very aware, and I just think this is so important, I'm so aware of the loss and grief felt by so many families who have lost loved ones to drug overdoses. Each life lost is one too many. The risk of drug overdose deaths can be reduced further by getting people into drug treatment and increasing access to naloxone. That's the antidote for opioid-related overdose, and I know you spoke about that. So my department is working closely with the HSE to increase awareness and accessibility to naloxone. So we are working on that. That is really one of our key issues going forward. It is important that this life-saving medication is made more accessible to support workers, peers and family members. In 2024, 1,758 people participated in the naloxone administration training, and 6,944 units of naloxone was supplied by HSE to services. I just want to reaffirm my intention to publish as soon as possible the successor National Drug Strategy covering 2026-2029, accompanied by what will be a 2-year action plan. So I also will have every 2 years an action plan. So that will be worked with all of us. See what more actions we need to take. Drugs are changing all the time. This is a changing world. And as you know, all of us in this House are very mindful of that. So we cannot be complacent about the harms and dangers associated with illicit drug use and a volatile drugs market. It is imperative that we have a drug strategy that is relevant to the times we live in and that responds to the continual health of society problems presented by established and new illicit drugs. So it is always changing. We also need to align our drug strategy with the forthcoming EU drugs strategy to reflect the urgency given to the drugs by the Citizens' Assembly on drug use. It is my intention to continue to engage with the Oireachtas in implementing the successor strategy, including the Joint Committee on Drug Use, so that there is cross-party support for the strategy. And again, look, I'm really glad to be here. As I said, we're not opposing this. All of us need to work together. Drugs is a huge challenge across the whole country. And all of us working together through services, through working with our drugs task force, that was brought up there. I had a topical there. We have 24 drug task force around the country who do absolutely excellent work, who are on the ground in the communities, and all the different agencies attached to that. So we really, all of us, and that's my aim as Minister, to work together to get the solutions, to get the strategy right, to get the services right for those that need it. And that's what I intend to do. And thank you very much.
Thanks, Minister.